Hey everyone, this is going to be a post-op video from my ACDF anterior cervical disc fusion surgery. I opted for the surgery after years of chronic pain in my neck and between C5 and C6. An MRI recently pinpointed that I had severe bone spurs, and the disc itself had been displaced quite a bit to where it was pressing near the back into my nerves and into the spinal cord. And after years of putting it off, I decided to opt for the surgery instead of trying to do any other kind of treatments such as epidurals and things like that. And I'm so glad I did. So just so you know, 2 days ago, actually a little less than 48 hours actually from surgery, I am now in my second full day of post-op. You can see that I'm not wearing a collar. You can see that the approximate width of the incision, it was about 1.5 inches, 2 inches maybe tops of an incision, and they went in and found that the disc itself was almost completely gone and replaced it, and here I am post-op. Now I wanted to do this video because most of the videos that I've seen that were post-op videos, especially if they're a year old, say 2014, especially 2013, you saw a lot of people in collars still. You'll see a lot of people in those videos in collars up beyond maybe even day 5. And I'm 2-day post-op. And I had the collar, a soft collar on. I was in the surgery for about an hour. Was in recovery for about 45 minutes to an hour. Was in a soft collar, was told I could take the soft collar off when I got home if I felt like it. If not, the next morning. I actually slept the first night in a soft collar and took it off the next morning and have not been in a soft collar since. You can see I have decent mobility. The only tightness around is actually around the incision itself as far as the neck and how it feels as far as tightness and soreness still. Yesterday was a day that I felt like I could swallow somewhat, but it was still difficult to swallow, but I was still actually eating solid food, not just liquid diets, as you'll hear some people say about their post-op. And so I've had everything from muffins to some chicken casserole to shakes to smoothies to you name it. I've been able to almost eat it at this point. Ice cream, cookies, been treated really well. So post-op has gone actually very, very, very well. The only discomfort again that I'm having right now is mainly around the incision itself, where it's still a little tight on the skin, moving up and down. But I'm assuming as that heals the next few days, it's going to go away quite a bit. I've had a little bit of tenderness in the shoulders due to the fact that since the disc that they replaced was almost completely gone, they had to separate the vertebrae to get the new disc in, and they said that that might cause some soreness in my back from just the muscle tension and things they've had to do to put on the muscles to get the vertebra apart to put in the new replacement disc. So I have a replacement disc, an acrylic replacement disc. It's not a bone graft of any sort or a cadaver, and I have a titanium plate now between C5 and C6. And I am so excited about the recovery process. Again, this is second full day post-op, and I'll try to do another one in a few days to see how my mobility goes. I've already noticed that the pain I used to feel in my arms, down my back, down especially in the back of my neck, around the tenderness around C5 and C6 is almost gone. So I'm very excited. There is no downside so far to this unless I have some kind of negative reaction the next 24 to 48 hours. I'm expecting a fast recovery. And again, you can see this is all I have left. 2 days post-op after ACDF surgery between C5 and C6. And according to the doctor, again, my disc that was replaced was in really bad shape. So I feel like I'm doing really well. I think the surgery has come a long way in the last 2 years, which is why, again, I wanted to show this post-op video and show you that maybe this is what you can expect now, 2 days post-op versus having to wear collars for several days. They did, tell me not to pick up any heavy objects heavier than a jug of milk, or don't try to drive in the next few days. But I feel like if I was driving somewhere I'm familiar with, I know there's still risk involved, but I feel really good. I'm still going to obey their recommendation as far as not driving, but I feel like I could drive if I had to. Let's put it that way. They just don't want you getting in an accident again and having any kind of sudden movement to your neck where it might be still the plate and everything's trying to basically get get set in place, I guess is one way of putting it. But anyway, 2 days post-op, no collar, tenderness only around the incision itself. Had just a little bit again in the arm yesterday. Had some difficulty swallowing a little bit yesterday as far as just a sore throat. Wasn't really tight. It wasn't that I couldn't swallow. It's just that it was like having a really bad sore throat and trying to eat. But today I woke up expecting actually to be worse, and to my surprise, I was actually much better. This has been an incredible day, and I cannot tell you how excited I am to know that I'm going to have some really good days ahead. I should have done this years ago. Lived with 10 years of chronic pain, 10 years of terrible pain in my neck. Pretty much gave up on things. Started to even get a little bit of depression, and thought I would never golf again. I grew up golfing. Thought I would never do a lot of things again. And here I am, actually very excited about what's lying ahead. So I wish, naturally, hindsight's 2020. I wish I would have done this a long time ago, but out of fear and everything, naturally, I put it off until it almost got to the point I had to. And here I am, 2 days post-op ACDF surgery between C5 and C6. And stay tuned. Hopefully, I'll have another good positive video here pretty soon, next few days, to show you my mobility. And especially as I start physical therapy, they want me to start physical therapy literally within a week of the surgery, so I start next week. So I'm expecting the progress to continue. So again, no collar, mobility pretty good. Second full day post-op ACDF surgery. Thanks.